Introduction to the emergency medical services. All right, topics. What are we going to talk about in this chapter? The emergency medical service system, or EMS, components of an EMS system. We're going to talk about your roles and responsibility as an EMT, the EMS role in public health. We're going to talk about some research, and we're also going to go over special issues. So let's get started. The emergency medical service systems, right? We're going to start talking a little bit about history. Although the modern day EMS is fairly new as far as the healthcare industry goes, we can date our roots back all the way back into the 1790s. This is the earliest documented EMS system. The French, during the French Revolution, when they were fighting Austria, I think Persia, and a few other countries, they decided to start transporting wounded soldiers away from the battle scene so they could be cared for by physicians. Prior to this point, they just laid on the battle scene until after the battle and somebody could come and care for them. So you can imagine how much this greatly helped with fatalities and deaths because they were able to get them off the battlefield. Our next point will be towards the Civil War. We're talking about Miss Clara Barton. Everybody knows Nurse Barton as starting the American Red Cross. She was also big in the Civil War era with moving injured soldiers from the battlefield where they could be treated. We're going to next look into the Volunteer Ambulance Corps. This was literally what it says. It was volunteer non-military individuals during World War I. It actually started in Britain or England, and then once America got into the war, we had our own Volunteer Ambulance Corps. By the end, if you do some research, they had like a couple thousand people and 300 or 400 ambulances. So this was kind of a big deal and something new. Our next point of history is the Vietnam and Korean War. This is where we grew substantially in the EMS world as far as the military because they started using advanced life care in the field. They had first aid stations, then they had MASH units that could stabilize and do emergency surgeries and then get them transported to more stable hospitals. This also was the era of the helicopter when we started seeing air medical. They used I believe they were like little Bell helicopters in Korea and then moved on to the Hueys in the Vietnam era. Now we're going to start talking about non-military ambulance service and how it began. It started in the early 1900s with very little emergency care, right? This is where in the 40s it was developed in smaller communities, usually operated by like either your undertaker or your funeral homes. That was a big part of it. Some fire services did it. So, but literally the undertakers would get a hearse and put a bubble light on it, and they would literally just go pick someone up, throw them in the back, and drive them to the hospital. That's where the term ambulance driver comes from, if you've ever heard that. Oh, they're just an ambulance driver. Well, the modern EMS, we're not ambulance drivers. We're highly skilled, highly trained individuals. But back then, that's exactly what they did. They would drive the sick or injured to the hospital. There was no organized system for EMS back then and no really trained personnel. 1966, the United States government decided that they had a need to develop a more standardized care in EMS and more training. So they came out with what we called the white pages. This is very important. You're going to hear the 1966 white pages a lot in EMS. This is what pretty much started modern day EMS. In 1970, the National Registry of EMT was founded. 73, the National Emergency Service System Act passed by Congress. This is what gave us our standard of care, to where you learn you don't get the same care that you would here in Illinois as what you would in Florida, Hawaii, wherever. The National Highway Transportation Safety Act, standard for EMS. This is the 1973. Regulations and policies. Each state established laws. They have a lead agency, which, like here in Illinois, we have the IDPH. They have policies, procedures, and regulations. So they're in charge of all of EMS. They're the ones that write the rules and on licensing, on training, on how we staff our ambulances, what equipment we carry. They're in charge of that. Okay. There has to be, per these standards, there has to be resource management. You have to have a centralized coordination of emergency treatment and resource. We have to have funding for all this. Then there's a section of human resources and training that assures that EMS personnel are trained and certified to a minimum standard, which means we're all trained to a very minimum standard. We can go above that training, but there's a minimum standard you have to meet to get a certain license. We have to provide safe and reliable transportation in the EMS world. Facilities. This act came out and said we need to transport to the closest appropriate facility. Now you will notice that the word appropriate is now being taught. Years ago it was just the closest facility. Now it's appropriate facility, which means, for example, if my local hospital doesn't do cardiology or doesn't have a cath lab, but I have a cath lab that's within reasonable distance, sometimes we'll bypass that little local hospital and go to the cath lab because it would be the closest appropriate facility. We will talk further about that in later chapters. We have to have a good communication system. We have to have a universal system for access number, which is the 911 system. We have to be able to talk from ambulance to hospital, or I'm sorry, from dispatch to ambulance. And then when we talk from ambulance to ambulance, we have to be able to talk to ambulance to hospital, and hospital to hospital to communicate. A lot of this communication is done via radio of some sort, but it can be used telephone. For example, like when we get dispatch, it's usually some sort of radio frequency. To talk ambulance to ambulance, again, another form of radio frequency. Ambulance hospital can be done one of two ways. You can either call them on your phone, call their GIMS line, or you communicate them through their Mercy line on the radio. So it can be done either way. And most hospital communications via telephone or internet, like they'll send information via packets and stuff over the internet. There has to be public information and education, right? We have to educate the public about the roles in EMS and access to EMS and prevention of injury. So part of your job in the EMS world is we will do these injury prevention issues and stuff. For example, one of the big ones is child safety seat inspections, bicycle helmets for the children, stuff like that. And there has to be a medical direction. So each system or in Illinois has a medical director. And this is a doctor, usually in charge of writing protocols and other things, but each system has one. And it's a good idea for you to learn who your medical director is and how you would access him if you need him. Trauma systems had to be developed. We had to develop trauma triage for transport and treatment. It's a good thing to learn where your local trauma centers are. For my students in my classroom, they will all be taught where the local is, but you need to figure out where your own local one is. Evaluation. So there has to be some way of evaluating to see how we're doing as far as EMS and how we can improve. That's where the QA, QI, TQM all comes in, where we get together, look over your own reports, see what we can do to make it better. If we need to change something, change it. If we don't, we leave it alone. That's what the evaluation is all about. Now, what are some of the components to the EMS system? All right, let's start talking about that. The first step is your emergency medical dispatchers. Activation of the EMS is in response to a patient's emergency. So when you call 911, you're going to get an emergency medical dispatcher. In most places, these are EMDs. Not all 911 centers have EMDs, but most of them in our area does. These are people that are trained to give information over the phone to start the care for that patient until EMS can arrive. Our next link in this component is the EMS responders. That would be EMRs and EMTs, paramedics. Fire departments have EMRs. Some police departments do. They may respond before the ambulance can get there and start care, and then the ambulance will take over. And then we'll talk about our next link, the emergency department of the hospital. They'll have doctors, nurses, and allied health personnel. Like, for example, the allied health is going to be x-ray techs, lab techs, uh, cardiology techs, stuff like that. So uh, then there are specialized care facilities like trauma centers, burn centers, pediatric centers, cardiac centers, stroke centers. Um, these are all good to know in your area. When you start working EMS, you need to know where your trauma center is going to be if you're close to one, because you may have to bypass and go to a trauma center. Burn centers, same with pediatric centers. All these are good, very good resources to know. All right. And here's a picture of the active accessing the EMS system. As you can see, it starts with the patient, and then somebody's calling 911 on into our emergency dispatch center, and then they're going to dispatch the resources needed, either fire, EMS, police, whatever. First responders show up on scene if they have them. Not every area has it. Then the EMTs or the ambulance will show up. They'll start patient care, stabilize, and then transport to the emergency room. And then from there, they'll get the allied health, and then maybe even they may need to be transferred to a specialty facility or a facility that can do extended care. So let's access the EMS system. 911, right? It's available in most communities. Now, there is a difference between 911 and enhanced. Enhanced 911 provides caller numbers and locations from landlines. They can also triangulate off of cell phone towers and get pretty close to a cell phone location as well. I say pretty close. Sometimes it's not super accurate, but it can get you fairly close. And then you have the EMDs, or the emergency medical dispatchers. They provide instructions to the patient or the caller on how to provide care until EMS providers arrive. Um, and going with this, research is consistently pointed to the importance of early access and promoting uh, emergency care and CPR. So, if you remember back in our CPR class, for the ones that are in my classes, we talk about the chain of survival. And one of the first links is early recognition and early activation of the 911 system. Well, if you're lucky enough to have an EMD back on that line, they can actually walk the caller through on how to start and how to continue CPR. Here's a nice picture of what an EMD center looks like. As you can notice, there's a lot of screens they're in front of her. A lot of stuff going on. My hat's off to these people. I couldn't do that. Skip this for now. All right, let's start talking about levels of EMS training. There are 4 general levels, right? At the very beginning, or at the lower tier, you have the EMR, or the emergency medical responder. Years ago, this was called first responder, but now it's called the emergency medical responder. They are trained um, on basic care, and they start care until the ambulance can arrive. The next tier, the next level, will be your emergency medical technician, which that's what this class is for, or the EMT. Okay, so they give basic life support. An ambulance can be staffed by 2 EMTs, which would be a BLS ambulance service. Um, our next level is advanced EMT. Now you're getting into your advanced life-saving support. An advanced EMT can do quite a bit, actually, almost to the level of a paramedic. And which would be the next would be paramedic, which is advanced life support, obviously. Paramedics can do anything from, they have a great big pharmacology on to a lot of cardiac issues. They can do IVs, they can intubate. There's a lot paramedics, any advances can do. All right, let's start talking a little bit about your roles and responsibilities as an EMT, right? Your roles and responsibility, personal safety is utmost and important, right? Your safety is number one, all right? So whenever I always ask or talk about who's the most important person on an ambulance crew, the answer is you. You as the EMT is number one. The second most important person would be your crew or your partner. The third would be your patient. And then the fourth would be everybody else. That is the the way it goes as far as the importance of safety on a scene. You're number one, your partner's number two, your patient's third, and then bystanders and everybody else is fourth, right? Some more roles you'll have is you'll be working with the public and promoting public safety, the injury prevention and stuff like that. We set up and do blood pressure clinics. Um, there's all sorts of things we can do, but you will, as an EMT, at some point in your career, you will probably participate in one of these public safety um, seminars and stuff like that. Patient assessment and care. That's your biggest role as an EMT. And your biggest skill is patient assessment. We'll get into that in later chapters when we start talking about patient assessment. But if you can't assess your patient, you can't treat your patient. You will be lifting and moving patients, of course, and we have a chapter later on that is devoted solely to lifting and moving. And as an EMT, you will be transporting the patient from wherever you pick the patient up to more than like an ER. You can be doing reverse. You can go from like the hospital and do discharge back to a home or long-term care, nursing facility, stuff like that. You'll learn that you have to transfer care, right? We'll talk about that later. And you have to be a good patient advocate. Everybody in this field, that is our job, right? Our whole main goal is to take care and help people, and we have to do it. Anything we do has to be in the benefit of the patient, right? We're not here to do harm or anything like that. That's so patient advocacy is a big, big role. Physical traits of a good EMT, okay? You should be able to lift and carry equipment and patient up to 125 pounds. Uh, you should have good eyesight for distance and reading. You should be aware of any problems with color vision, right? And good communication skills, both oral and written. These are all very important. But with that being said, it doesn't mean you can't do this job if you don't see the best in the world. You just may have to adapt it a little bit. Um, so these are just good guidelines. Doesn't mean you can't do the job if you have a little weakness. But with the oral and written skills, you should be very, very fluent in those two. Personal traits of a good EMT, right? You should be pleasant, right? You should be very, very pleasant. Sincere. That's why we got into this. You want to help somebody. You want to be cooperative, and you want to be resourceful, because sometimes you have to think outside the box. You have to improvise. You have to be very resourceful as well. Here's a nice picture of what a professional appearance would look like. And it says here that professional appearance inspires confidence. And that's a true statement, right? I wouldn't want someone showing up to work on me or one of my family members and they were, looked like they wore the same uniform for 3 shifts in a row, all dirty, food all over it, hair all messy. They don't look like they've bathed in a while. It doesn't portray that they know what they're doing. So good personal appearance inspires confidence. You should be a self-starter, emotionally stable, and a leader or able to lead, right? Neat and clean. We talked about that in that last slide. And of good moral character and respect for others. That's huge, right? We have to have good morals and we have to respect everybody. You should be in control of your personal habits. Controlled in conversation, ability to communicate properly. That is true, and we'll have a whole section out later. Able to listen to others, because if you can't listen, right, you can't find out what's wrong with them. And non-judgmental and fair. We can't be judging people. We have to be fair in our treatment. That's just a given, right? Education. All right, you have to maintain up-to-date knowledge and skills. This is not a type of career where you get a license and you're done learning. No, it's a constant learning. And in order to do that, there's refresher courses. You will be required by your coordinator or your system to do continuing education courses. Most places that you work for will offer a monthly training, at least a monthly training, but you can also do it online. There's your system coordinator or your system will have their own sort of training. So it's fairly easy to get this continuing education, but you just have to do it. You can attend conferences, seminars, lectures. You can use stuff like YouTube. Um, there's a lot of free online stuff out there as well. You just have to be very resourceful and find uh, it's out there. You just have to look for it. Yes, it's a good statement. Many EMS rescue and operations adapt new procedures and equipment on the basis of research providing evidence that they're effective. You're going to hear me say this term a lot in this lecture or a lot in this course, that EMS is an evidence-based practice, which means we do stuff because it works. And then once something new comes out, we'll test it. And if it works, we'll do it. If it doesn't, then we won't, or we may have to change it. So if the evidence changes, then our practice may change. Where will you become a provider at? Ambulance service, right? Uh, EMTs can work in ambulance services. Fire departments can use EMT. Rural wilderness teams use them. Urban industrial setting. These are like safety officers or first aid personnel at like a factory or big industry stuff. And volunteering, right? You can be a volunteer EMT on an ambulance service or wherever. And do a first aid for a school, whatever. So there's a lot that you can do with your EMT. Well, and one thing they didn't mention is a lot of hospitals will hire you as like an ER tech or certain techs with an EMT degree. There's a nice picture. All right, National Registration of Emergency and Medical Technicians, the NREMT. They registrations for EMRs, EMTs, AMT, and paramedics who successfully complete your examination. And as a EMT candidate in the state of Illinois, you have to take a national registry exam to get your license. The only exception to those four is the EMR. We still have a state EMR where you can do that in your class, but they also offer a national, so you can get a national EMR if you want to. Where this comes in handy, or what makes this nice, is if I'm in Illinois, get an EMT license, and then all of a sudden I move for some reason to, which is say Michigan, I can transfer my license from state to state through a term called reciprocity, and it's very easily done if you have a national registry. Now you can get it done if you're just state registered, which Illinois doesn't recognize that anymore as being just state registered, but you can do it. It's usually a longer process and maybe more intensive process, but if you have a national registry, it's a pretty easy process. And it's also beneficial if you have your national when it comes to applying for certain positions. Um, During the COVID era, or when they were doing deployments, a lot of these companies required that you have a national licensing to deploy. So that was one of the benefits. Some companies may use you as a traveler, and you're required to have a national. So you just have to check with the company you're planning on being hired with and see. But like I said, if you're in Illinois, you're going to have a national regardless. So, all right, let's start talking about quality improvement. Right, we have to always continuously self-review to see that we're doing the best job that we can do. Right. So in order to do that, we have to um, review our reports and stuff like that. So we have to develop a plan to correct any deficiency to improve our performance. So if we're seeing we're not doing something correct, maybe we just need some added training or go review training, stuff like that. That's where the QI comes in. Everybody has a role in quality improvement, right? Preparing. So your role will be to qualify or to prepare carefully written documents. You're going to be becoming involved in the quality process. Uh, some of this would be obtaining feedback from the patient and hospital staff if you can. Maintain your equipment, right? And continue your education. These are all ways we can improve the way we perform. Let's talk about your medical director. All patients' care performed under a medical director, which means you as an EMT will be working under your medical director and his licensure, right? So they are ultimately responsible for the patient care. They oversee all the training in your region. They develop your treatment protocols. So they're the ones that writes the protocols. They also can issue offline medical directions, which is your standing orders or your protocols, and they provide online medical direction. Let's talk about offline and online medical direction real quick. Offline is the treatment that you do via your protocols, right? I know we haven't gone over it yet, but for example, a patient with chest pain, we're going to give them aspirin and nitro via protocols. Now let's talk about online. If I have a question or need advice, I can call my medical direction, which is your hospital in your region, and talk to the ER doctor, which would be your online medical director at that point, and get guidance on how to treat this patient. That's your online medical direction, right? So if I have a question like my blood pressure is a little iffy and I don't know if I should give nitro or not, I can call my medical direction, which in this area, in my area, would be St. John's Hospital in Springfield, and I can talk to an ER doctor and ask him, right? Even though I won't be transporting my patient there, I still call my medical director or direction, which would be St. John's Hospital. All right, EMS roles in the public health, right? One of the big roles is prevention, injury prevention for geriatric patients. We see an issue, we go into a nursing facility or an assisted living or even the residents. We see, like for example, in this picture, there's a rug they could easily get tangled up on or trip on. We're gonna maybe see if we can talk them into removing the rug. All kinds of stuff like this. Injury prevention for the youth. So we talked about the car seat inspections, the bicycle helmets for children, stuff like that. Public vaccine programs, disease surveillance. So if we have a certain communicable disease that we notice, we'll have to report that. So we're going to survey that. Research. Research is big in our world, right? Two ways research affects EMS. It focuses on improving patient outcomes and through evidence-based techniques, right? We talked about the evidence-based practice earlier. We test out a technique and it works. We're proving that it works, and we put it into play in the field. I don't know if you know, but most of our practice comes from the military. It starts in the military, especially our trauma-based stuff. And we find that we have certain equipment or certain techniques work really well, and then we'll bring it into the civilian world. In order to use evidence-based process, there's steps, and the first step is to form a hypothesis. So we have to, well, this will probably work, all right? Then we're going to review literature. We're going to research and see if it'll work. Evaluate the evidence by actually trying it, and adapt the practice if the evidence supports it, like I just talked about. So they try it, and if it's proven to work, we put it in the field. Now, that doesn't mean that will always be our practice or technique, that there may be something better come along, we'll replace it with something better. The basis of EMS research. Dynamic nature of treatment makes research difficult. Not all research is created equal, right? Embrace the best practice of conducting and evaluating research. This goes a little higher usually than the EMS. This is going to be will be in your like system coordinators and stuff where they collect all the data and they take it up to the IDPH and they have meetings and they figure out what is the best practice. So that's usually a little above us, but it starts with us by writing good reports, right? And doing good care. Research relies on scientific method. General observation turned into hypothesis. Prediction tests to prove or disprove this hypothesis. There are different types of medical research, right? We got peer review research in the medical journals, and there's articles in EMS magazines. not original researched or non-peer. All right, let's talk about special issues real quick. Throughout this course, we will be discussing local issues. We'll be talking about stuff that happens in your local area. We will also be talking about administration matters. We'll be talking about the course description, the class meeting times, which you've already done that. If you're attending my class, we have an orientation night where we talk about what you're going to learn in this class, when we're going to meet, and the requirements to get your EMT. But if you're not in my class, let's go over the requirements really quick. You have to attend a certified class or a class that's approved by the IDPH, and your coordinator, which is usually around 160 hours. You have to attend a certain minimum amount of time in that class. You have to get a passing grade of at least 70%, and then you have to get at least a 70% on your final. You're also required to do a minimum, I believe, of 40 hours of clinical experience, which includes hospital ER time and ambulance ride time. So you have to complete all that. And once you're done with all that and you successfully completed your EMT course or class, then you will be able to set and take your National Register EMT test. And once you have taken that and successfully passed your EMT, then it'll go to your state or your coordinator, and then you will be issued a license. You will get a National Registry EMT license, which is good for 2 years, and you will get a state of Illinois license, which is good for 4 years. And then you have to, within those 4 years, you have to do your continuing education. And we're not going to go over that too much because each region is different in the state of Illinois on what they require and how many hours they require. So that will be up to your coordinator. The students at my class that'll be in my region, by all means, come to me and I will let them know. The American with Disability Act has strict guidelines preventing the rights of Americans with disabilities, which means that even if you have disabilities, you are able to take an EMT class. Now, with that being said, that doesn't necessarily mean that you will get a job on an ambulance service, because reality is if you're disabled and like in a wheelchair, you're not going to be able to perform the function of that EMT on the ambulance. That doesn't mean you can't get your EMT in. It doesn't mean you can't work as an EMT. You just may not work on an ambulance or a specific field. Let's review a little bit. The EMS system is developed to provide pre-hospital as well as hospital emergency care. The emergency system includes the 911 and other emergency access system, which would have dispatchers, EMTs, hospitals, ERs, doctors, nurses, PAs or physician's assistants, and other healthcare professionals like X-ray techs and CT techs, imaging, telemetry, all this other specialties, or respiratory therapist. Come on. Oops. There we go. The EMT's responsibility includes safety, patient assessment and care, lifting and moving, and transporting patients. Then you're going to transfer care to your nurse once you get to the hospital, and you have to be a good patient advocate. I think we talked about all these earlier. An EMT must have certain personal and physical traits. Remember, we talked about all that. You have to be resourceful. You have to, have a good attitude. You have to be able to listen. You have to be able to communicate well. These are all good attributes that an EMT would have. And then you have to have education. Not only do you have to take your class and pass the test and get licensed, you have to continue this education throughout your entire career by doing refresher trainings, continuing education. We'll do quality improvement procedures. You'll be working under medical direction at all times. And you're held at a higher standard. Remember, EMS also dates back to the Napoleon times. Remember, the 1790s is what we talked about. Modern EMS started in the 1960s and 70s, and the National Emergency Medical Service System Act. It was in 1973. There is a chain of human resources involved in EMS. Critical decisions are made by each member of this chain. starting at the dispatch level on up to physicians. There are certain personal and physical traits that help you to be a successful EMS provider. We went over through all those, and you're more welcome to review or rewind the video and go back over them if you need to. An EMS provider should actively pursue opportunities to improve personal knowledge and ability as well as their unit's overall quality. That is a very, very good statement. You should always, it's a constant learning with EMS. Everything changes a lot. Not everything, but there are a lot of changes in EMS, so it's good to stay up on all that education.